So these are the things that we need to do normal trach maintenance. This is an everyday thing, and I know that it looks like a lot and it can be overwhelming, but it's really not. First thing you're going to find out is that germs in the hospital and germs at home are two completely different things. In the hospital, when they do this, they're going to be cleaning the trach and suctioning the trach with sterile gloves. Once you get home, you really only need like these regular exam type gloves. We buy ours on Amazon, and I buy them in boxes of like 200. They're super cheap. They're like $6 or $7 for a box if you shop and find the right one. So you need to make sure that you're gloved up, and that's just to protect you and the person that you're doing the trach care on. The next thing you're going to need is a tracheostomy clean and care tray. This has really, to be honest with you, the only thing in this that I use are the cotton swabs. So we actually bought like medical type cotton swabs also because they're cheaper than our insurance having to buy these trays. But I wanted to show you the tray just the same. So the tray will come with a pair of sterile gloves, a towel that you can place over top so you don't spill anything or get anything on your patient, and then some other trach type cleaning supplies. But like I said, the only thing that I really use out of this are the cotton swabs. The other thing you're going to need is you're going to need a solution that is half sterile water and half hydrogen peroxide, and that is just to clean around the stoma. And then finally, the trach collar, which holds the trach in, and an inner cannula, which I'm going to show you how to do this. So I'm going to give the phone to my wife real quick. Okay. So I pour a little bit of this, just a little bit, just enough to soak some of the cotton swabs into this container. And we just soak them real good. So we come in here around here and we just want to clean out from under. Just get around it really, really good. You want to be gentle. And if there is any secretions, you don't want to wipe, you want to dab. That way you don't tear scabs or anything like that. And I go back and get another one. And basically, if you understand what the stoma looks like, it's just a hole right here. You're really just cleaning around that hole. That's all you're doing, just to make sure that there's no bacteria or any germs that can get in there. And I normally do this with 2 or 3, depending on how grimy it is. And keep in mind, again, we do this every day. So I normally go around it 2 or 3 times. And we're clean, so that's good. Also in the kit are some little cotton pads, and I just use those to dab any excess liquid that I got on him. Okay, so that's that. So the next thing I'm going to do is I'm going to go ahead and change this collar. Now this collar doesn't absolutely have to be changed every day. I don't change Jacob's every day. I change it about every other day. But if you get it wet in the shower or something like that, then you definitely do need to change it, because you don't want that dampness flying. Now you have to be very careful when you change these, because this is the only thing holding the trach in. So when you release it, a cough or a huge exhale or anything like that could pop that out. You definitely don't want that to happen. So I always just hold it with my fingers just to make sure that it doesn't come loose. And I don't know what kind of holders you'll get for Mac. There's a number of different types. I like these. I like the Velcro, and they're a very soft material. And the old ones just go in the trash. And that's that. So that's changed. Finally, the only thing left to do is change the inner cannula. So inside the trach is this tube. It's called an inner cannula. And I just actually ask him, are you ready? 1, 2, 3. There we go. We take it loose. We just pull the old one out, discard it into our garbage, and put the new one in. That's it. There you go. Sorry. And that's all there is to that. The only other thing that with a trach that you'll have, now we have a Shiley, so I'm assuming that Max will be the same thing. You have a cuff in here, and you can tell whether that cuff needs air or not by feeling this little balloon that's on the outside. So this is connected to that cuff, which is on the inside, and it actually is, if I squeeze this, it expands that cuff inside his throat. So I try not to do that, just very gently. And if it needs air or it has too much air, you can give or take away just very gently with this little syringe, just like that. And that's perfect. So that's good. The only other thing that we do is we put a split 4x4 up underneath there to catch any fluids that may drain and basically protect his skin. I got these from our ENT. I don't use this end, but it's really good for pushing it up underneath there. I just push it there and I can get a hold and pull it through. You do this on both sides. And that's it. We're finished. That's all there is to it. We have to do that every day.
Smile, Jacob.